Welcome to the Explainer. Today, we're diving into spina bifida, a condition that starts right at the beginning of life, often before anyone even knows a new life has begun.
So let's start with a pretty deep question, right? What if one of life's most critical moments happens before you even know it started? This really gets to the core of why we're talking about this today.
28 days, that's the window. Spina bifida develops in just the first 4 weeks after conception. That's a time so early, many women don't even know they're pregnant yet.
Okay, so what is spina bifida, really? To get our heads around it, I want you to think about something super simple, a zipper.
So here's the textbook definition. It's a birth defect that has to do with something called the neural tube. And the neural tube is, well, it's basically the blueprint for the entire central nervous system, the brain and the spinal cord. It's the command center for the whole body.
And this is where that zipper analogy really comes in handy. Just imagine the spine forming by zipping up from the bottom to the top. But with spina bifida, that zipper gets snagged somewhere along the way, and it doesn't close completely, leaving a little opening.
And here's what's happening on a microscopic level. It all starts as this flat little sheet of cells. Then, the edges of that sheet start to fold up towards each other, kind of like you're folding a piece of paper. And then, they're supposed to fuse together and create a perfect tube. Spina bifida is what happens when that final, crucial step, that fusion, doesn't quite finish the job.
Now, that little unzipped spot can look really different depending on the person. So you see, spina bifida isn't just one thing. It's really a spectrum, and it's broken down into 3 main types. So first up, we've got the mildest form, which is called spina bifida occulta. Occulta literally means hidden, and for a really good reason. There's a tiny gap in the bones of the spine, but the spinal cord itself is totally fine. Actually, most people who have it never even know, unless it just happens to show up on an X-ray for something completely unrelated.
Next in the middle is meningocele. Now in this case, a little sac of fluid actually pokes through that opening in the back. But, and this is the important part, the spinal cord is not in that sac. It's still safely inside, which usually means there's little to no nerve damage.
And then we have the most severe and, as it happens, the most common form, myelomeningocele. This is what most people are picturing when they hear spina bifida, because here, that sac contains not just fluid, but parts of the spinal cord and the nerves themselves, leaving them exposed and, unfortunately, damaged. So if we lay it all out, it's actually pretty simple. It all boils down to 2 key questions. Can you see a sac, and is the spinal cord involved? The answers to those 2 questions tell you everything you need to know about how severe the condition is.
Okay, so this all leads to the really big question, right? What causes this? And maybe even more important, can we do anything to prevent it? The answer, incredibly, is a huge, resounding yes. Now, there are a few things that can raise the risk, like family history or certain medications. But there is one factor that stands head and shoulders above all the others as the most important, and thankfully the one we can do something about.
And here it is. This is the magic number, 400 micrograms. That's the daily dose of folic acid, it's a B vitamin, that's recommended for all women who could become pregnant. Why? Because folic acid is like rocket fuel for making new cells, which is happening at an insane pace when that neural tube is forming. Taking it before you even conceive and through that critical first month is just absolutely key.
And the impact? It's just staggering. Getting enough folic acid can slash the risk of spina bifida and other neural tube defects by up to 70%. This is honestly one of the greatest public health victories of modern medicine.
But what does it actually mean to live with this condition every single day? Well, the effects are as unique as the people themselves.
The challenges someone faces really depend on where that opening in the spine is. As a general rule, the higher up the gap is, the more significant the impact. It often affects things like leg movement, bladder and bowel control, and sometimes it can lead to other issues with bones and joints.
And a very common partner condition is something called hydrocephalus. It sounds complicated, but it's basically a buildup of fluid inside the brain. And it's typically managed with a really clever little device called a shunt, which just drains the extra fluid away.
So, how is modern medicine stepping up to these challenges? Well, the advances in both finding and treating spina bifida are, frankly, pretty remarkable. You see, today, detection can happen long before a baby is even born. Doctors can use a combination of blood tests and incredibly detailed ultrasounds to spot the condition early on. This gives families and their medical teams precious time to prepare and make a plan.
Surgery is really the cornerstone of treatment. The traditional way is to close that opening on the baby's back within the first day or 2 of life. But now, surgeons can do something that sounds like it's straight out of science fiction: fetal surgery. They can actually repair the baby's spine while the baby is still in the womb, and this can lead to much, much better outcomes down the road.
But that first surgery, well, it's just the beginning of the journey. Managing spina bifida is a lifelong team effort. It involves a whole crew of specialists, physical therapists, urologists, orthopedic surgeons, all working together to help a person live the fullest, most independent life possible.
And this, right here, is probably the most important thing to remember. Yes, the challenges are real, but the outlook today has completely changed. With the right care team, the future for someone born with spina bifida is so much brighter than it's ever been.
And all this leaves us with one final and I think really powerful question. We have the knowledge to prevent up to 70% of these cases with something as simple and cheap as a vitamin. So you have to ask, is the biggest challenge now a medical one, or is it a communication one? How do we make sure this life-changing information gets to every single person who needs to hear it?